If HR 639 passes, you can probably start to get what you're paying for, which is healthcare from your doctor and not your insurance company.
Did you get all that?
It's time to talk about one of the biggest hustles in American healthcare. And I'm talking health insurance. No, I'm talking actual health insurance, not even health insurance fraud. You pay like $12,000 a year, plus you have a deductible on top of that, which is the money that you have to shell out before your insurance company will cover their part. If you have a problem, which is what we want insurance for, health insurance will not show up for you until you've paid your deductible. These insurance premiums, they only ever go up. They don't go down. They only go up. Why do they go up? Well, because health insurance companies say, well, the cost of doing business is going up. The cost of healthcare is going up. Meanwhile, they're posting record profits. Health insurance companies have a number of cost controlling measures. These are not to help pass the savings along to you. It is not to help bring premiums down. It's not to help decrease the cost of healthcare. It is to make them more profit. One of their main tools is something called a pre-authorization. You meet with your doctor, you come up with a plan, and you make this plan based on your doctor listening to your health history, doing an examination, and relying on their extensive education. That goes to the insurance company. Now, the way that they claim it, they want to use pre-authorization as a way to make sure that the members of their health plan are getting the best evidence-based care ever. They also say that it helps keep the cost of healthcare down. Remember those insurance premiums? They never go down. Deny, delay, defend. Does that sound familiar at all? 1 in 7 pre-authorization requests are denied. 1 in 7 times, the insurance company is telling the doctor, you know what, you got it wrong. You don't know how to do evidence-based medicine as good as we do. They got it wrong. They picked the wrong drug. They picked the wrong treatment plan. For some reason, all of the best and most brilliant medical minds in the country only work at insurance companies. And 1 in 3 people will end up skipping treatment or delaying treatment. And I don't think it takes a genius to figure out that this is not in a patient's best interest. Sometimes you're required to try a different treatment that has worse side effects because we're saving money. Not for you. Remember, premiums only go up. So what are we going to do about this? Finally, there is something called HR 639, a resolution that's being considered in the House. It makes pre-authorizations by insurance companies illegal. It makes utilization management techniques illegal. It makes medical necessity reviews illegal. Won't this just drive the price of healthcare sky high? Well, guess what? We're already there. Your premiums aren't coming down no matter what. You need to get in touch with your representative and tell them that they need to pass HR 639.